Hello, welcome again, this isotope in the treatment of cancer. Please like, comment and subscribe. In chemistry, an isotope refers to one of the two or even more species of the atoms within a chemical element and the one that has a similar atomic number as well as position within the periodic table. There also exists a notable characteristic that is mainly involved in identifying an isotope. An isotope has nearly a similar identical chemical behavior, but it has varying atomic masses as well as the physical properties. The majority of the chemical elements have either one or more chemical elements, and these determine the aspect of the reactions of these isotopes and other essential aspects of the reactions of the involved elements. Radionuclide therapies are the type of the therapies that are currently and increasingly being utilized for the treatment of various forms of cancers. The major reason is that a large number of cancer traces have been recognized and they allow the utilization of targeted radionuclide therapy. Lymphomas is the greatest example of a form of cancer that might be treated using radio-labeled antibodies that are taken up by the cancer tissues. The antibodies are taken up by the cancer tissue and later destroyed by the means of radiation as well as formation of antibody. PET-CT and SPECT-CT imaging are the greatest categories of imaging that use the concept of isotopes in the treatment of cancer. It is also an integral part of the radionuclide therapy. The major thing or idea brought about by the imaging is that it tells the extent at which radioactive materials accumulate in the tissues and also aids in identifying the therapeutic dose that is required and also the effects of the dosage. Therefore, a sufficient dosage of radiation is delivered to the tumor tissue and it is confirmed by the aspect of imaging. Additionally, numerous treatment sessions might be required so that an effective dosage and treatment of the disease might be attained. Nuclear medicines are receiving an increased and widespread utilization of nuclear medicines. Specifically, radiation has become a widespread thing, especially in the diagnosis and also treatment of the numerous medications. Specifically, cancer is among the essential diseases that are treated through the use of the nuclear medicines. The most important thing to realize is that the nuclear medicines offer essential information concerning the functioning of the organs of the human beings. Use of radioisotopes. The majority of the hospitals use radioisotopes, especially in the diagnosis of cancer and also predicting the essential requirements that are important for the treatment of the disease. Isotopes are being used in combination with imaging devices, and these are meant for registering the gamma rays that are emitted from within. The aspect is allos related to the issue of radiopharmaceuticals. The essentials are used for diagnosis and they are used in combination with radioactive dose that is provided to the patients so that they get the required information concerning the disease they are suffering from and ways of mitigating the disease. Notable procedures have to be followed, and the aspect is related to the upcoming procedures that are mainly involved in combining the computed X-ray tomography so that they might scan individuals to offer recognition of the co-imaging. The aspect is also related to the instance of the gamma cameras. In this case, the aspect of isotopes in medicine, especially in the treatment of cancer, is an essential aspect that might not be undertaken in the absence of the gamma cameras. Therefore, the cameras use the aspect of isotopic elements so that they might detect the cancerous tumors and elements that are essential for the treatment of cancer diseases. Bone and soft tissue might be imaged, unlike it is the case with the aspect of the X-rays. One of the essential advantages of isotopes or radiation as compared to the X-ray technique is that the bone as well as the soft tissues might be imaged successfully. The major difference that might be realized is that the undertaking is unlike the aspect of X-rays, whereby soft tissues and bones might not be radiated effectively and might require the use of specialized machines that might not be afforded or used within the system of isotopes. The other important thing to realize as far as the instance is concerned is the positioning of the radiation element. The only thing that is required in the case of isotopes is only the positioning of the source of radiation instead of nuclear imaging, as it is the case with the other techniques of imaging such as X-rays. Every organ and tissue within the human body functions differently from the chemical point of view. As an example, absorption takes place differently. Due to this case, doctors and other pharmaceuticals have become at an increased instance of identifying the chemicals that are essential or those that might be absorbed within no time. In this case, isotopes have been viewed as essential elements that might penetrate the body and organs of the human body with ease. As an example, iodine will better penetrate in thyroid glands while glucose will penetrate better in the human brain. The overall implication is that the doctors and other pharmaceuticals will use isotopes in the treatment of cancer, especially in the brain, since it has a high rate of absorption. Reference slide for the sources used in making the presentation: Adelstein, S.J., Manning, F.J., and Institute of Medicine, U.S. 2015, Isotopes for Medicine and the Life Sciences. Washington, D.C., National Academy Press. Rahman, R.O.A., and Insala, H.E.D. M. 2018. Principles and Applications in Nuclear Engineering, Radiation Effects, Thermal Hydraulics, Radionuclide Migration in the Environment.